Hello everyone. As mentioned earlier, we shall be discussing real-time patients in my practice following each lecture module. We will be discussing a case on preconceptional counseling as the first case in our course. I welcome you all to the wonderful journey where we understand and take into practice every single history while dealing with such patients in your practice. Case number 1. A 36-year-old grand multigravida came to the hospital for advice to plan next pregnancy. She is G5P2L23. She is a known case of hypertension since 3 years under tablet amlodipine 5 mg OD. She had underwent previous to caesarean section followed by 3 abortions for which dilatation and curettage was done. She had underwent sterilization 3 years back. She has a family history of her sisters diagnosed and treated with breast malignancy. How will you counsel the patient? Let me know in the comments section. Let us discuss in detail. Hint 1. She is 36 years old woman which states she is at risk of increased maternal age. If she conceives, there are higher chances of development of diabetes in pregnancy and development of intrauterine growth retardation in fetus leading to preterm labor. Hint to her obstetric score is G5P2L23 signifies she is a grand multigravida. Grand multigravida is defined as more than 4 previous pregnancy. It states that even if she conceives, it is a high-risk pregnancy. Hint 3. She is a known case of hypertension, which in pregnancy leads to uteroplacental insufficiency leading to decreased in blood supply to fetus, leading to IUGR and if severe enough intrauterine demise of fetus. Hint 4. She has underwent to previous caesarean section and 3 dilatation and curettage. It denotes her uterus is already weak lacking support which after pregnancy may lead to postpartum hemorrhage. In simpler terms, severe blood loss after delivery severe enough to cause death, or can lead to uterine inertia. Uterine inertia is inadequate contractions during labor which increases the chances of C-section. Hint 5. She had underwent sterilization, which requires a surgery to fuse the cut end of fallopian tube to facilitate implantation of the blastocyst in the uterine cavity. Even if the fallopian tube is fused, there are increased chance of blastocyst developing in the fallopian tube which is termed as ectopic pregnancy. Ectopic pregnancy is a pregnancy which develops anywhere other than the uterine cavity. Hint 6. She has family history of breast cancer in her sisters, which has numerous risk factors in its own. So initiating the process of breast milk secretion during pregnancy may prove to be a controversial risk factor. Hint 7. Patient already has 1 boy and 1 girl child which completes the family. In such situations, the counseling physician should be vigilant enough to interpret and analyze the history, understanding all the risk factors, and after discussing with her partner, patient left the hospital happily and healthy. Remember, it's always the patient's autonomy to choose the treatment of care they need. Let's meet in another wonderful case discussion. Thank you. Hello everyone. As mentioned earlier, we shall be discussing real-time patients in my practice following each lecture module. We will be discussing a case on preconceptional counseling.